Hello, everybody. I hope you have been having a fabulous day hearing all kinds of cool stuff about healthcare. We are about to give a presentation about how to prevent a breach of your IT systems and what to do if something bad happens, because no matter what a good job we do, we can't protect against everything. So our presentation starts with Justin Frazer, who is the Director of Risk and Healthcare Consulting at Mazars, and he's going to tell you a little bit more about himself. And then I will speak. I'm Stacey Gulick from Garfunkel Wild. I'm a partner and the head of the HIPAA and Risk Management Practice Group. So I hope you enjoy this session and are having a wonderful time all together. Thank you.
Thanks, Stacey. So just to piggyback on what Stacey did in her introduction, the way the presentation is going to start is I'm going to go over ways to prevent a breach, go over some best practices, talk about high trust a little bit, talk about some of the risks that we're going to see. And then, as said, Stacey will conclude it. Take it after myself. Just by way of introduction, my name is Justin Frazer. I work at Mazars. We're a professional services firm. I'm in the risk consulting and healthcare group. I oversee our high trust team as well as our data forensics team. I am an attorney admitted in New York, though most of my practice now is on the consulting side, and it's great to be here. Thank you for having me. So let's jump right in. A data breach should be expected. So these first few slides, my sole point here is to scare everyone, because it's not if the breach happens, it's when the breach happens and how to be prepared. So let's start off with safeguarding protected health information. Your data as a healthcare organization is an attractive target. The value of personal health data can range from $10 to $1,000 per record in the online marketplaces, depending on the completeness. You have a fairly continuous stream of new employees, so it makes many new targets for criminals to send phishing or hacking attempts. Systems are interconnected, so if one system is hacked or violated, criminals are likely to get into other systems. This is going to be a theme I'm going to stick with. Vendors. Vendors are the Achilles heel of healthcare organizations, and I'll get into this a little bit more. But your vendors have varying levels of safeguard. They all, some of them have your data, or multiple of them have your data, especially ones that you hire. But some vendors take more precautions than others. There's a lack of security resources and processes, and the criticality of services provided make them susceptible to extortion. The landscape is continually evolving. 50% of US firms were breached by ransomware last year. Nearly 35% of these firms paid the ransom to release their data. However, only 70% of those victims who paid regained access. So we're in a scary time here. Ransomware has evolved into a double extortion. Attackers extract sensitive information, sometimes for months before they even encrypt the files. And if the victim hesitates to pay, the hackers release some of the stolen data and then threaten to post the remainder. So looking at this slide, two things I want to point out. There's 4 key paths to exploitation: stolen credentials, phishing attacks, exploited vulnerabilities, and use of botnets. Ransomware has continued an upward trend and involved in 25% of breaches in the past year. Supply chain, again, vendors, is responsible for 62% of system intrusions, and the healthcare industry was the most common victim attacks caused by third parties, accounting for 33% of the incidents in 2021. And then 82% of the breaches involve the human element, whether it's stolen credentials, phishing, or simply due to an error. People continue to play a large role in the incident and breaches alike. If we look at this chart to the right over here, you can see in healthcare, as we list industries, health, financial services, healthcare is #1 where data breaches are the most expensive for the organization. There's not only the remediation, the reputational loss, but then In healthcare, there's also the fines imposed by government agencies. So healthcare is number one. Safeguarding protected health information should always be one of the highest priorities for every healthcare organization because it is extremely expensive. So as I said earlier, let's talk about your vendors and can you trust your vendors to secure your data or protected health information? You're a healthcare organization and you have numerous vendors that you delegate your core competencies to. And many of those vendors, in delegating your core competencies, have access to patient data and your patient data. So whenever you utilize a vendor for, say, telehealth or population health or any other service utilization review, if you're an insurance company, those vendors are going to have your PHI to do, or your patient's PHI to do their work properly. A vendor's ineffective policies or procedures can lead to significant fines and penalties from OCR. However, reputational loss and other costs can be significantly more impactful. Continual monitoring of service license agreement and requiring external audits like SOC 2 or high trust, which I'm going to get into in a little bit, are the most effective means to gain assurances of the cyber protection of your data held by third parties. Quickly referring to this chart here on the right, these are the most common ways that privacy and security violations happen. For privacy, the most common violation is extended amount of time to provide patient data, impermissible disclosure of PHI, and the lack of or non-compliant business associate agreements. On the security side, the more technical side, the controls for safeguarding data, failure to conduct an enterprise-wide risk analysis, poor management processes, or ineffective access controls, again, are how data is breached on the security side. So the question is, how can you verify that your vendors can provide assurances that they fully comply with HIPAA regulations and industry best practices for safeguarding of PHI? So we have the answer here in 5 bullet points. Conduct third-party screening, onboarding, and due diligence. Build mature third-party management processes. Clearly define roles, responsibilities, escalation paths, obligations, and timeframes. Ensure that your service level agreements exist in the contracts, and require an annual external audits of critical third parties. So these are what is the recommended path to ensure that your vendors are securing your protected health information. I'm going to take a minute now to talk about high trust. For ambulatory surgery centers, this is not so prevalent. In my practice, as I head the high trust team at Mazars, this is something that is mandatory and imperative on the managed care side. Historically, this was created for managed care vendors. Essentially, if you're a vendor and you have PHI from your managed care strategic partner, most managed care organizations would not even speak to you or consider procurement unless you have a high trust certification. The reason why I want to speak about this today is just, I think this is going to continue to grow in our field. I don't think it's going to stay with managed care. What I've been seeing a lot of is my practice now has been switching to hospitals and health systems. Hospitals and health systems, I'm seeing more and more look for a high trust certification for themselves and for their vendors. In fact, there's a large trade association of some of the larger hospitals in the country, Kaiser, Mayo Clinic, Cleveland Clinic, that is now recommending that their vendors have a high trust certification in lieu of a SOC 2. So this is something that we're going to continually see. And I want to stress that if you have a vendor and they're high trust certified, this is an assurance in and of itself that your data is most likely secured in the best possible means. So what is HITRUST? HITRUST was created by a consortium of 9 healthcare organizations to address concern over data breaches, inconsistent requirements and standards for safeguarding data, compliance issues, the growing risk of liability associated with information security in the healthcare industry. So these are the 9 organizations, and the general rule was if you're a vendor having PHI and you want to contract with one of these 9 organizations, you will not be permitted to do so unless you are HITRUST certified. Organizations that are not here in the managed care space, many of the local and independent, as well as other large ones that are not listed here, are also most recently requiring HITRUST certification from their vendors. So this is something that, because the threat is so real in the healthcare space, HITRUST is not becoming the exception. It is more and more becoming the rule. There's 3 types of HITRUST assessments. There's the basic current state assessment, the I1, which is the 1-year assessment, and the R2. The basic state and the I1 were only released in 2022 as possibilities. So prior to 2022, if an organization said it was HITRUST certified, that meant they were R2 HITRUST certified, which is full compliance with HIPAA. The basic state is the lowest level of assurance and the lowest level of effort. And the I1 is a medium level of assurance and a medium level of effort. But interesting enough, hospitals and hospitals and other large health providers and health systems are requiring their vendors to get the I1, not necessarily the R2. However, in the managed care space, we are seeing that all vendors need to have the R2. For both hospital and health systems and managed care, the basic assessment is not enough, but this is a good starting point to kick the tires to test the controls. Why is HITRUST so good? And why is it so becoming the industry standard? HITRUST is the only solution that integrates 40+ authoritative sources into one certifiable framework. So if you look at the sources below, you'll see the regulations for HIPAA are there. You're going to see ISO, NIST. You might notice that the GDPR, you can get certified under GDPR. So if you're a healthcare organization doing business in Europe, this will assure that you're meeting GDPR requirements. Many state requirements are part of the HITRUST. So if you're certain states have certain requirements that are above and beyond HIPAA, those can be added to the HITRUST certification, as well as PCI, which is payment card industry standards. So if your organization collects credit cards and has credit card data, that can also be added to HITRUST. Final slide on HITRUST. Why is not everyone getting it? Because it really is a bear. It's going to take about 6 to 18 months to get a HITRUST R2 certification. It's pretty expensive. It's 3 phases. Where it starts is the scoping and readiness, where an assessor firm like Mazars would come in and do a readiness assessment. We'd identify all the gaps. That's the middle phase. That's lighter. It says integrate into operations. We would take all the gaps and do a remediation, and then after the remediation, integrate those into the healthcare organization's operations. They need to be in place for 90 days before we could do the final stage, which is the validated assessment. Unlike a SOC 2, the HITRUST Alliance will ultimately give the thumbs up or thumbs down of whether the healthcare organization meets the requirement. Us as Mazars or assessor firms or other assessor firms out there, we would lead the assessment, lead on the journey. We would make our recommendations, we would score, but ultimately it's up to the HITRUST Alliance that would decide if the healthcare organization is worthy of the certification based on its controls. So whereas a SOC 2, any accounting firm can issue the SOC 2 report, but here ultimately it's going to be HITRUST that issues the report. Okay, so my final part of my presentation is practices to consider to avoid a breach. So I've come up with 597 practices to consider to avoid a breach, and I'm going to read them all to you right now for the next 30, 40 minutes. Actually, that's kidding. I've come up with only 13, but this way I'm going to read you a list of things to consider of 13 practices to avoid a breach. I guess one of the challenges here, if when you're speaking and you're speaking alone, it's pre-recording. There's no laugh track, or I'm not getting any audience involvement. I should, Stacey, I should ask you to hit the laugh track whenever I tell a joke. That way I can get the satisfaction that people are laughing at my attempts at humor. Anyways, here we are.
I just want to let you know I am laughing.
Oh, thank you. I appreciate that. Thank you. At least we have one. Okay. So practices to consider to avoid a breach. Annual security risk assessment. This is a HIPAA recommendation that providers conduct an annual security risk analysis for vulnerability. Limiting access to health records. Number 2. If you have employees that don't need to look at the medical records or PHI, don't provide them access. You're making yourself more vulnerable. Consistent security awareness training for all of your employees and contractors. Because there's a high turnover, your employees are your greatest weakness and your greatest asset in preventing cyber attacks. So continually do training, at least annually. Document your incident response plan. Creating and implementing a response plan is essential in helping your practice avoid escalations where a breach or incident occurs. The plan will give you clear guidelines for the necessary decisions and follow-up measures, and then create sub-networks. Your patients, your visitors, and personnel shouldn't all be on the same network. Have different networks so that if your patient network, your public network is hacked, they won't be able to get, or criminals won't be able to get into your patient's data. Personal devices. I know at my job, I use my iPhone for work, and many companies allow people to use their personal devices for work. If you allow your employees to bring and use their phones or other electronic devices, create a strict and clear policy that outlines which devices they can use within and outside the network and how to connect to them regularly. Update your software regularly. Frequent software updates can correct any of the system bugs and lower the risk of cyber attacks. Back to my theme of monitoring your vendors. When choosing a third-party vendor that will need to access patient data, verify that they comply with HIPAA. If they say they're high trust certified, that is the best assurance, but there are other means to verify. Not all vendors are high trust certified, so there are other means. Have an attorney like Garfunkel review your service license agreements to ensure that your organization is the sole owner of data and you can consistently revoke access when the contract is terminated. Avoid using outdated IT infrastructure. Older equipment is more likely to be breached, and you should consider replacing outdated devices to reduce the risk of data breaches. Encrypt your data. According to HIPAA rules, if encrypted data is compromised, it's not considered a breach. So encryption technologies can significantly mitigate the consequences of cyber attack. Every organization should have a retention schedule. A retention schedule is critical to ensure that electronic health records containing sensitive data stay or don't stay in the digital environment longer than required. HIPAA typically requires 6 years, but some state laws have a 10-year statute of limitation, specifically define what to keep and how long and where it is kept. And then on to the other end of that, destroy sensitive information that does not need to be retained. Some confidential information could be securely destroyed, considering hiring a reputable document destruction company to assure sensitive information cannot be accessed. And finally, invest money in your security. The mantra should not be investing in security if we get attacked. Instead, you should invest in security in preparation for when you get attacked. It is critically not only to have an advanced network security team, but a strong IT team and definitely a strong legal team to help you with the responses and to quarterback all of the legal and regulatory requirements if there is a breach. So that concludes my portion of the presentation. I'm going to stop sharing. I'm going to put myself on mute. I'm going to hide myself and give the floor to Stacey.
Thank you, Justin. That was great. And hopefully everybody will only ever have to pay attention to the first part of this presentation and do everything that Justin advised, so you never have to get to me, which is, what do we do if something bad happens? Unfortunately, even with the best of efforts, it's sometimes unavoidable because these hackers and viruses are very, very sneaky. And the reality is most of these breaches are caused by people making mistakes. And there's just very little we can do to prevent that. But okay, so the first thing is prepare. The OCR requires you to have a security incident response plan written, and the more detailed, the better it'll be for you. You don't want to get to be in the middle of a crisis and say, oh, what was I supposed to do first? Who was supposed to do what? That type of thing. So the OCR wants you to have a security incident response plan in writing. In addition, what I'm starting to see more and more of is that cyber liability insurance carriers are also asking to see evidence of a security incident response plan. In addition, healthcare partners, some of my clients that are entering into unique arrangements with health plans or other health systems are being asked to demonstrate that they have a written security incident response plan in place prior to entering into the relationship. So this is something that is becoming increasingly important and that needs to be paid attention to. In addition, it helps you to a little bit focus on, hey, how can we intersect our disaster recovery plan with our incident response plan and maybe test them all at the same time, as usually they go hand in hand. So just some little points to keep in mind, but it is a very good strategy to start out saying, hey, have I got an incident response plan and have I tested it before you find yourself in the middle of a crisis. Then the next thing to do is to stop the potential problem. You want to stop the information from escaping or being used or accessed inappropriately to the extent you can. Fix that misconfigured port, remove an infected computer from the system, maybe unplug the computer, something simple as that, isolate it. But you don't want to destroy anything so significantly that you're unable to investigate what happened or who was impacted. Like several years ago now, I was working for a hospital. They had a vendor who did all their discharge transcriptions. And that vendor used a third-party subcontractor out of the country. So hundreds of thousands of discharge transcriptions get sent to the transcription company, who sends them 1/3 to this out-of-country subcontractor. All of a sudden, a nurse at this hospital puts her name into Google and up pops the discharge summary of her recent admission to the hospital and all of the discharge summaries that she had ever written, which was a big, everyone realized something had gone really awry. It was figured out what. They contacted me and I said, tell the out-of-country subcontractor to shut down the FTP site that is allowing the Google sniffers to get in. And in my mind, Google sniffers are really cute little robots, really cute, that go in and steal information. So what this out-of-country subcontractor did is they literally took a hammer to the server to prevent any more Google sniffers from getting in. So when we went to do the investigation, we were unable to identify whose information had been on the site. So instead of just having to send notifications to 1/3 of the discharges of this hospital, we had to send notifications to everyone who had ever been discharged because we couldn't tell whose information had and had not been affected. So important, when I say stop the bleeding, don't destroy the patient, so to say. Okay, you got to keep it intact enough to be able to investigate. You want to make sure to start out with notifying insurance counsel or insurance carriers and legal counsel. If it's a big enough potential breach, you want them on board with you. A lot of times your cyber liability insurance carriers are going to have its own vendors that they want you to use, whether that be forensic consultants, breach coaches, legal counsel, that type of thing, mailing vendors. So you want to start off with those relationships early on. Even if you're not going to notify your cyber liability insurance carrier, if you think it's something big, you want to notify your legal counsel. There are a lot of legal landmines. Some, not even everything we're talking about today. There is even more. So you want to have legal counsel helping you navigate these rough waters. Now, if a business associate caused the breach, something to keep in mind is that even though the law is written in such a way that at the end of the day, it's the covered entity who holds the ultimate authority or responsibility for making sure all notifications are sent if required. However, the OCR, the HIPAA police, as we like to call them, following the Anthem breach, remember a long time ago, millions and millions and millions of people impacted. Following the Anthem breach, the OCR said, listen, if a business associate causes a breach, the covered entity whose information was affected can delegate to the business associate. Such delegation should be in writing, either in your business associate agreement or by email or whatever. Can delegate the responsibility for making the notifications to the patients. And some of my covered entity clients even go so far as to say, business associate, when you send out your notifications, don't even mention us. Talk about what you did and how you're going to fix you. Don't mention us. So it's something to keep in mind. Even if it's not in your business associate agreement that the business associate will do that, typically they are willing to be cooperative if they want to keep your business, right? It's a good business move. If they hurt your information, they should take care of meeting the regulatory requirements. Okay, so now you've notified your cyber liability carrier, your insurance counsel, you figured out if it's the business associate or you that has to take responsibility for all of this. You want to establish your response team. Hopefully, as I said, my first slide, you already have a security incident response plan in place and know who your team is and actually have all your phone numbers in your security incident response plan. So you know who to bring on board. Certainly your privacy and security officer are going to need to be involved. IT staff inevitably are going to need to assist you with this process. Someone you might not have thought of is that you want to have appropriate PR staff or somebody who is the person to do your marketing or how you appear to the public. Very important person to have on that team. And then operational representatives who can assist you in looking at the workflows to identify what happened. So hand in hand with that, you want to identify a spokesperson. My experience with these extremely large breaches is that there is a deluge of questions from sources you wouldn't even expect. Physicians, your entire medical staff, actually, the patients, the media, your stakeholders, possibly even your vendors or other partners you have. You want to have someone who knows where the status of your investigation or your response is, and who can answer the questions in an appropriate manner without speculation and that type of thing. I had an incident several years ago. There are these individuals, they're called hackers, gray hat hackers. There's white, gray, and black. Black is obviously the bad ones. White is someone you hire. The gray hat hackers, what they do is they have these algorithms, they troll around the internet and they find open ports or some way to get into your computer system that you didn't expect. They go into your server, they extract a little bit of information just as proof of life or whatever term you want to use to demonstrate that they actually did get into your system. And then they say, hey, hire us. We'll destroy all the information you had so you don't have to handle it as a breach, but hire us to fix that open port. So that's why they're not exactly black, but they're not certainly white. Anyway, so what happened in this particular instance was the gray hat hacker was calling the hospital, and the hospital was ignoring them. And so they were angry. The hackers were angry. So they took the information that they had stolen from this hospital and went to NBC, who published it. For sure, it was a horrible mess. And the PR people at the hospital were like, why didn't anybody tell us? Because nobody knew to involve them, to answer these individuals when they're coming and saying, listen, we have your stuff. We want to work with you. Let's figure this out. And everybody ignored the situation. So very important to identify a spokesperson, someone who knows how to handle the questions and inquiries that might come down the pike. You want to consider what consultants you want to use. As I mentioned previously, I think, or I'm going to mention a few times, forensic consultants are very important. They're very expensive, but they're very important. They can assist you in determining, was there actually a breach? How many people were impacted? When did it occur? Do you really have to send out all the notifications? They're tremendous assistance with all of those things. They should give you a report that supports whatever route you're going to choose to take in regard to this. Legal counsel, as I said, there's a lot of landmines legally in this story, things that I'm not even going to get a chance to get to, but really you'll need help. And then breach coaches, which is a new thing that I kind of am like, maybe I can come from one of those. They kind of hold your hand and walk you through some of the things that aren't exactly technical and aren't exactly legal, but are still stressful. So they assist you with those types of things. All right, we're ready to investigate. We have our team inside and outside, and we know who's doing what. Let's take a deep breath. This is stressful, I know. Then consider when the potential breach may have occurred and how did it occur? How did this virus or this ransomware or whatever get into your system? Which patients have been infected and what information was involved? Most notably, we want to know if clinical and financial were involved. That's going to guide future steps that you're going to need to take. You want to differentiate whether the information was actually accessed or could have been accessed. The OCR says that if you have a ransomware attack, you have to assume that the hackers or the bad actors access the information, even if, unless I should say it this way, unless you can demonstrate through forensic analysis that they did not. So a lot of times people say, well, the hackers don't want more information. They just want us to pay to unencrypt it. That's what ransomware is. But that's not what the OCR views it. The OCR views it as a breach and that the information has been accessed unless you can demonstrate otherwise. And you want to try to figure out who accessed the information. Even with the Anthem breach that I had mentioned a long time ago, I don't think they were able to actually ever figure out exactly who accessed it. They think it was a foreign actor acting in one of the Asian countries, but no one knows for sure. But to the extent you can, it is a little bit helpful to know who. And also certainly you got to determine if the information is still publicly available. For example, when that gray hat hacker gave the information to NBC, they also posted it through a social media site on the internet, and we had to go through huge machinations to get all that information taken down. The sites will sometimes assist you, but not always. But it is something you want to mitigate the harm. And part of that mitigation involves making sure that additional people can't see the information. You have to decide whether you're going to involve law enforcement. I've worked on many, many breaches, and I've worked with state police, the FBI, Homeland Security, Secret Service, on and on. And sometimes you need them, and sometimes you don't. Or I shouldn't even say need, because there's not much they're going to do for you in regard to your breach identification and breach notification requirements. They're not going to opine one way or another on all this, but they can make it appear that you've taken this breach more seriously, and they may be helpful in ensuring that it doesn't happen again by catching the bad actors. So it's a little bit of a conversation. I can't say there's a black or white line test as to when you want to involve law enforcement. It's just something to discuss with your legal counsel to consider. You want to make sure that you inform key stakeholders. A big mistake I made years ago when I first started doing these breaches, I was working with the chief medical officer of a hospital, and they had a fairly significant breach. And so we're doing everything right. We're preparing the notices. It was more than 500 people. So as I'm going to talk about, when there's more than 500 people involved, we sent out the press releases to local papers and on, did everything perfect. The local papers, when they got the press release, published it. And I got a phone call from the CEO who said, I had no idea this breach occurred. So needless to say, it was a big political quagmire. And not a mistake we'll ever make again. So I'm passing this wisdom along to you to make sure that all of the key stakeholders, whether that be board members, administration, your medical staff, people that are going to be inundated with questions, all the key stakeholders should be on the same page and know what's going on so that they're not blindsided. They can direct questions to the right person, and that no young lawyers are getting in trouble. Not that I was necessarily that young, but all right, so now we have all the information, but you want to make a decision now. You've looked at the facts, you've done your forensic analysis, you know who's involved, what happened, or to the extent you can, and you have to decide, well, is this a breach that requires notification under HIPAA and or state law, first of all, or do we have enough support for the notion that there was a low probability of compromise and can instead document a risk assessment? Again, this is a time when your legal counsel can be super helpful for you. Sometimes if you want to go the route of a low probability of compromise, forensics teams can provide additional support for you. The OCR has not been terribly forthcoming in defining what is meant by a low probability of compromise, so it's a little bit of a gut check. But certainly, again, something to consider. You don't want to go making notifications if you don't have to. It gets really expensive. All right, now you've decided, all right, I have to make the notifications. Under HIPAA, you have to notify the affected individuals and the OCR. So the big number with this breach notification thing is 500. If it's less than 500 people who have been affected by the breach, then the OCR must be notified by March 1st of the year after the breach occurred. So for instance, if there was a breach in October of 2022, the covered entity or a business associate who's ever making the notifications would have to inform the OCR, hit the button at some time prior to or on February 28th. So that all reports are done by March 1st of 2023. So if the breach happened in 2022, the report goes 2023. Timing is important with these notifications. When you're sending the notification to the individuals, regardless if it's 5 or 5,000, it has to be done as soon as possible, but no later than 60 days after the date that the incident was discovered or should have been discovered. So you get a report of a potential breach, note on your calendar 60 days from the day you learned of it. Sometimes you can play with those dates a little bit, but that's pretty much. And the OCR has entered into settlement with covered entities that have failed to make the notifications within the 60 days. I think the most significant settlement was with someone who didn't do it for 100 days, which they really, really missed their deadline. But according to the law, they can penalize you every single day that you miss that 60-day deadline. If it's more than 500 people, life is not great. But 500 is the big number. So in addition to making the notifications to the individuals, you are going to have to notify the OCR at the same time as you send out the letters to the individuals. And the OCR is required by law to investigate you, so you can't escape. In addition, you have to send the breach notice to 2 media outlets. Some people like to send it to small local newspapers, thinking that nobody pays attention to them. Some people like to send it to the large New York Times of the area, thinking that it won't be sufficiently newsworthy to be published. The covered entity or business associate has no obligation to ensure that the information is published. It just has to send the press statements. It's a discussion, it's a game day decision as to which type of media you choose to notify. In addition, if there's more than 10 people who get returned, your letters returned of more than 10 people, then you will need to post a notice on your website clearly and prominently. The OCR will ask for evidence that you've done all these things, notified them, notified to press media outlets on your website. So you keep track of all these things because you will need to produce that information for the OCR. Some other ideas disassociated with all these notifications you have to do. You may want to consider hiring a vendor to assist with mailing. Your cyber liability insurance carrier should assist you in identifying a vendor. They might even have some that they require you to use. They're a big help. It's much, much more than just sticking an address on an envelope and stuffing the letter in there. You need to, get rid of duplicates, try and update addresses of people who have moved, keep track of the number that are returned. The vendors are very, very helpful with this phase. You consider whether credit monitoring is involved. It can be very expensive, but certainly if financial information was lost, that is a step that the OCR would expect you to take. Consider setting up a call center. If it's a really large breach, you are going to get a lot of questions, and having the call center allows you to prepare responses to FAQs, to set up policies about when certain complaints need to be elevated, and to keep track of the complaints you receive, because the OCR again will ask for summaries of all of these things, the statistics regarding complaints, how you handled them, how many notifications were returned, all that stuff the OCR will ask for when they come in and investigate you. There are some additional state requirements in addition to HIPAA. Usually it's the state where the patient resides that is the law that applies, not the state where the covered entity is located. Some states like New York now require any time that there is a breach that requires notification to the OCR. Now in New York also requires notification to the state attorney general and other cyber liability agencies. And there is a little bit of language that has to be added to the HIPAA breach notification letter when that occurs. More and more states are expanding their breach reporting obligations to mirror the HIPAA requirements in addition to financial issues. Some other states only require notification to the individuals and or the state agencies if certain information like social security number is involved. But the thing is that when this incident occurs, you're going to have to figure out all of the states in which patients of yours reside and look at the laws of each of those states to determine their notification requirements. So it gets to be a little hefty work sometimes. Okay, now you're going to prepare for the government investigation. I have been saying this for so many years, but I'm just going to keep going with it. You need to maintain an up-to-date risk analysis and risk management plan. And if you haven't, if you find yourself in a breach notification requirement, go get that done as fast as possible. You can't undo the fact if you didn't have it before the breach, you got to live with it. But to demonstrate that you've quickly gone and got one, if you haven't, it does go a long way with the OCR. Ensure your policies are up to date and implemented. I know I've been in many breach investigations and people show me policies where it still says insert name. Make sure your policies are living things that are available to your staff. Ensure training has routinely been occurring. Fortunately, this is usually not a problem when I'm responding. Healthcare providers and their business associates seem to really understand keeping track of HIPAA training. So that seems to be something where people are really good about. Ensure staff are prepared to ask questions. Who's the security officer? Do you share passwords or emails encrypted? That type of thing that you're supposed to be implementing. The OCR can come in and ask them questions about that. And as I'm going to talk about in the next slide, you're going to want to correct any deficiencies you identify when you're looking at anything. Like, make sure that you don't just have a risk analysis, have a plan to identify the deficiencies that are identified in the risk analysis. If you don't do the second part, the first part you might have well not done either. I just want to note that it is not only the OCR that can come in and investigate a breach. The state attorney generals are also all authorized to do so, and many of them do. The good thing to know is that you can't have an investigation by both the OCR and the state attorney general. At least you can't have an enforcement action by both. They might both investigate you, but only one of them can impose enforcement action. Anything else? Okay, this dust is kind of settling. You've made your notifications. You want to now think about one, or maybe you've been thinking about it all along, but really think about it now. Are there any corrective actions to prevent this from happening in the future? New technical security features, policy changes, that type of thing. The OCR will ask for evidence of all of those things when you investigate, and it looks good if you try to fix things going forward. Do you need to have another risk analysis performed, even if you have had one in the last few months? Maybe it's time to redo another one to make sure it's up to date. Any re-education, everyone likes to see that all the time. And you need to consider any changes need to be made with your vendors. Again, this is when your legal counsel might be helpful to you, but I have seen plenty of breaches where the covered entity has decided, hey, even though this business associate stepped up to the plate with notifications, their inadequate security features mean that it's time for us to be done. Again, all of these things, including any relationships that you terminate with vendors, will be requested by the OCR when they investigate. So with that, we are going to have a live Q&A session this afternoon. So Justin and I will be available to talk to you all the things that we presented here if you have any questions. We really appreciate you participating in this, and we hope you're having a wonderful time at the conference. Thank you. Bye-bye.